Hi, guys. My name is Morgan Lima. I am the founder and owner of Hand to Heart CPR and First Aid Training LLC. I've been a nurse for nearly 10 years and a nursing instructor for 4. I love teaching nursing students. It's one of my favorite things to do. And today we're going to be talking about a topic that among nursing students is kind of known as the more stressful or scarier type, but we're going to make it not scary today. And that topic is pharmacology. If you are a nursing student and you're dreading pharmacology and the name pharm just even gives you anxiety, this video is for you. Pharmacology is challenging and it can be overwhelming and anxiety inducing, but it doesn't have to be. And so what we're going to do is break down how to best learn pharmacology. And then there's going to be more videos on the actual subject itself that we're going to help you break down these complex topics so that it's not so scary and so that you can digest them in smaller amounts. Okay, so first we're going to talk about how to pass pharmacology in nursing school. I know it's a really challenging subject, but it is one of the most important subjects you'll take in nursing school. In order to pass this course, you can try the following. So first, what you're going to do is figure out your learning style. Are you a visual learner who likes diagrams and color-coded charts to organize your information? Are you an auditory learner who likes to listen to videos and listen to concepts explained out loud over and over again? Are you a verbal learner who grasps information by reading and writing it? I personally have a little of each of these. I do the best when I can take a complex topic and write it out to where I can then teach someone else it. And once you're able to teach someone else a really hard topic, you know you've got it. Another type of learner is a kinesthetic learner. So a kinesthetic learner is one who learns best by actively doing things. So with your hands, taking different bottles of medications and organizing them by class, stuff like that. Knowing your learning style is going to help you determine which study activities and resources will help you absorb and learn the material quickly. Your learning style will help determine the best way for you to study pharmacology. Once you figure out the best way to study, you're going to study at a time and place where you learn best. Pharm is challenging and it will help to do the bulk of your studying when your brain can focus. Otherwise, you're going to have to spend additional time reviewing medications repetitively. To be efficient, choose a time when you study best. Like if you wake up in the morning and your brain is just ready to go, you've gotten great 8 hours of sleep, get your cup of coffee. That's the first subject you're choosing for the day. Okay. If you learn best or do your best thinking or you're creative in the nighttime, choose that time to study your pharmacology notes. For more efficiency, study in an environment conducive to your learning. You may enjoy being around your classmates, but if you spend 90% of your study session talking about upcoming events or socializing, then study groups may not be for you. You could also try studying independently in the same room as your classmates and just asking questions when you get stuck on a concept. And finding what works best for you is key. You can also do Zoom study sessions where everyone's muted and you're independently studying. And then when someone has a question, you unmute yourself. That's been a really positive experience for a lot of students. So then, of course, you can always use Picmonic to help you learn pharmacology. Picmonic is the ultimate study resource for nursing students because it covers thousands of pharmacology and nursing facts. I'm not exaggerating, thousands of them. Through picture mnemonics and unlimited quizzing, Picmonic walks you through how to learn pharmacology and remember and retain those medications. So with Picmonic, you'll have a personalized dashboard with customized study recommendations and daily quizzes with spaced repetition to maximize recall and retention. And since nursing students are always on the go, the Picmonic app is perfect for studying anytime, anywhere. Next, you're going to practice those NCLEX style questions. Memorization is key, but it's only half of the puzzle. Applying pharmacology concepts is when the real learning happens. So practicing those in-click style questions will help you contextualize what you've studied and view pharmacology through a clinical lens. It will reinforce your understanding and ultimately help you recognize medications and just how they work in real-world situations. Overall, it's going to improve your clinical judgment skills and prepare you for any pharmacology exam. So feel free to follow our pharmacology study guide for nurses for extra practice as well. Okay, next, and speaking as a nursing instructor, this is one of my favorite ones. Utilize your professors and instructors. When in doubt, ask your professors for help. That's what they're there for. Sometimes hitting the books and reviewing notes can be a lot. And if you're struggling with a pharm concept or you need advice from a pro, your best bet is to ask your professor. They want you to come to them with your questions. They want you to pass their class. They want to help you succeed. So utilize them. Prepare your list of questions ahead of time. Attend your professor's office hours. Even if you don't have a question, if they have office hours or study sessions, show up. Just be there if your schedule allows, because you may learn something that you didn't even know you had a question about. And finally, don't give up. I know that this can be really challenging and really frustrating. If you feel like you're ready to throw in the towel, don't, because sometimes all you need is a well-deserved break. You're spending a majority of your time right now in nursing school. And then you have other responsibilities outside of that. Don't let it break you down. Find a time where you can take a break, not think about pharmacology, not think about nursing school or anything like that. Re-energize yourself and then come back and start from where you left off. Because memorizing drugs and mastering pharmacology, which is what you have to do as a nurse, it can be exhausting. So if you're feeling overwhelmed, take a deep breath, step back. It's okay to take a beat and come back to studying later. It's all about balance, okay? So at this point, you might be thinking, pharmacology is hard, and I have to understand how I learn best. But how do I memorize the drugs? So let me tell you. As a pharmacy student, you're going to have a lot of exams and quizzes, and you're going to feel like you're going to need to memorize every single drug. That's not how you're going to do it, okay? So first, what you're going to do is you're going to start studying early. You're going to study often. There are a lot of details in pharmacology. Do not cram for these exams. You're going to go step by step as you're learning them. It's going to seem overwhelming if you wait till the very end. It's going to be hard to sort through all the different details. Study a little bit each day. Even when you have class, study afterward. This makes studying manageable. And the more you see a concept or a fact, the more likely you'll retain it. When I was in nursing school, I had Post-it notes all over my mirror because I knew I'd look at my mirror every day. If there was something that I just couldn't seem to recall, write it on Post-it notes, stick it there. You're seeing it every day and it's getting in your head. Studying and reviewing medications using Picmonic's Pharmacology mnemonics is going to help you to remember these different drugs and their classes, which I'll get to in a later video. So use different activities to summarize and supplement what you've learned. What I mean by that is, remember those learning styles we talked about? This is where they come into play. Choose activities that correspond to your primary learning style, and don't be afraid to experiment with different methods too, because you may think, oh, I'm a visual learner just because that's what I've always been. You can change as a learner as you grow and learn new things. So be sure you're trying different activities and different styles of learning, okay? So here are some activities that you can do if you want to try out your different learning styles. So let's start with visual. If you're a visual learner, you can draw diagrams or pictures to understand which drugs fit in a class or the mechanism of action. And Picmonic is really good with helping with that too. You can look at the different mnemonic devices that Picmonic offers, and there's visuals where they have like little play on words with basically saying how a drug acts. And the first example I can think of is beta blockers make me LOL, right? So beta blockers, propranolol, metoprolol, they all end in LOL. That's a whole class you just learned right there, just because of that little mnemonic device, okay? So utilize Picmonic's visual and auditory supplements. If you're a verbal learner, charts and tables are a good way to summarize information and understand which drugs belong in a class and make it easy to notice key differences in side effects or administration. Making flashcards can help you summarize the most important things to know. Not everything deserves a flashcard. And if you put too much information on a flashcard, it kind of negates the purpose. So find that sweet spot. Use these flashcards to quiz yourself later. You can also do a piece of paper where you're writing a drug class at the top and its suffix, like ACE inhibitors end in pril. So, and then below this, write key information like the drugs in the class, mechanism of action, specifics about each drug, and their side effects. Take 5 to 10 minutes to study your notes on a specific topic. Say them out loud. Speak your notes. Don't just read them out loud. Once the time is up, write down everything you remember on a blank sheet of paper or a whiteboard and check your answers with your notes and highlight the things you missed. Taking in the information is one thing. Recalling it is another. If you are an auditory learner, you need to be able to explain the concepts to others. It's so important. And that's a true test to see if you understand it. Challenge yourself more by seeing if you can explain it in a way a fourth grader can understand. Like I said before, it's one thing if you can memorize information. Being able to teach it is a whole other ballgame, much less teaching it to someone who's much younger than you. So if you can teach this information to a fourth grader, you're good to go. Another way that auditory learners can practice is listing all the drugs in the class, talking through mechanisms of actions, or recalling key side effects in order to just be able to spit that information back out and do it over and over and over again. For example, emergency drugs to lean on in a crisis are lidocaine, epinephrine, atropine sulfate, and naloxone. Little phrases like this make it easy to recall. Okay, kinesthetic learners. This one's for you. If you learn a medication is administered subcutaneously, you can pretend to administer it each time you say it aloud or think about it. And this way, that medication, the action, will be connected. Okay, muscle memory can help during exams. And finally, another way for kinesthetic learners to practice these skills. Look through textbooks or class notes to find examples where you can apply what you've learned. Now that you've kind of have an idea of how you're going to take this information in, you're going to want to quiz yourself to see what you've retained. So the difference between step 2 and step 3 of quizzing yourself is now you're completing these activities without notes, without any helpers, okay? So for example, try filling in a blank diagram or chart. Next, complete the quizzes associated with the Picmonic videos. Picmonic's daily spaced repetition quiz in particular can help you retain the information long term. The SMART software algorithm helps you review with a quiz right before the forgetting curve sets in. And so it allows you to memorize information and see it at spaced intervals. Guys, I wish I had it in nursing school. That's all I can say. After quizzing yourself, just remember, always evaluate what you know and what you don't know, and spend time reviewing the things you missed and try again. Understanding how you study best and using the right strategies will help you succeed in pharmacology. Not only will these strategies help you ace your pharmacology course, but they will help you retain that information for board exams and clinical practice. Remember, you are preparing for the real world. You're not preparing for a test. And so you've got to be able to take this into clinical practice, especially when you become a nurse. It's never too early to prepare for life after school, okay? Finally, you can break down medications by class. That's something I mentioned earlier. Categorizing these medications is so important because by memorizing the class, you're going to be able to list what 100 medications can do. So memorizing medications is challenging simply because there's so many of them, right? The best way to start memorizing medication is breaking them down by class. So first, start with the major drug classes. Think of ACE inhibitors, steroids, antibiotics, and so on. And then think of each medication within that class and its prefix or suffix. Following your list, that would be pril, stir, sulfa, and so on. And this will help you identify medications that you may not recognize at first. And also, new medications are coming on the market every week. It's impossible to memorize all the medications because some of them haven't been made yet. So we need to be able to know what different classes of drugs do. Finally, think of how each medication works in that class. This will help you begin piecing together medications, their classes, and their effects. You can use mnemonics and acronyms. This has really helped me personally, not just in nursing school, but in the clinical realm as well. Because, like I said, new medications come on the market all the time. And mnemonics are handy memory tools to help you quickly memorize the drug classes. Picture mnemonics are especially helpful as they activate different pathways in the brain to help you remember. More activated pathways equals stronger memory. So that's why Picmonic videos are great tools for memorizing pharmacology. With funny and memorable characters like beta fish for beta blocker, penicillin for penicillin, and halo poodle for haloperidol, you can memorize just about everything you need. Another good approach is to memorize the drug's acronym. So they're shorter and easier to remember if you use flashcards too. So for example, PCP for phencyclidine, E for ecstasy, and THC for cannabis. Make flashcards. That is probably, if you walk away not remembering anything, this is one of my biggest pieces of advice is to make flashcards. You can use them on the go. They don't even have to be physical flashcards. You can download an app that you have flashcards on your phone and you just tap your screen and it flips to the other side. They're easy, they're convenient. Write the name or acronym on one side of the card, and then on the other, write its class, generic name, indications, side effects, mechanism of action, major contraindications, patient education, and what you need to assess. Whew, that was a lot. But if you're not a fan of a pile of note cards, the Anki flashcards, they pair perfectly with Picmonic to practice memorizing drugs and their information, would be the way to go. So you can quiz yourself with each flashcard and make a pile of ones you do and don't remember to review the ones you've struggled with. And now we're going to start with some frequently asked questions about nursing pharmacology. So these frequently asked questions are very interesting. The very first one makes me laugh. Is studying pharmacology hard? So what do riding a bike, making the perfect pancake, and studying pharmacology all have in common? None of these things are easy the first time we try them. Learning something new is always challenging. It's uncharted territory. We don't know if we're doing it right, and it is incredibly uncomfortable. But being uncomfortable means you're growing and building new knowledge. So long story short, yes, pharmacology is tough, but you're tougher, okay? Which is harder, anatomy or pharmacology? So anatomy focuses on bones, muscles, ligaments, tendons, organs of the human body. It requires memorizing specific structures, appearances, location, function, connectivity. Understanding these elements requires diagrams and other visual elements. So on the other hand, pharmacology focuses on specific medications, how they work, when they're used, how they are administered to patients, and the side effects that they may cause. And there are lots of medications and unique details to know about each. Both anatomy and pharmacology require memorizing a lot of information. Anatomy is highly visual, but pharmacology is not as visual. Knowing your learning style is going to help determine if anatomy or pharmacology will be challenging to you. So hopefully that answers that question. Is there a lot of math in pharmacology? So pharmacology classes may require you to memorize specific medication doses or calculate the dose for a patient. These calculations are simple and they don't require much math to complete. What is the main goal of nursing pharmacology? Pharmacology is critical for nursing. Without it, nurses wouldn't be able to treat patients. You're gonna come across pharmacology in every single specialty of nursing. So it's critical to master. Nurses need to be able to identify and learn medications to address a patient's needs. And more importantly, to avoid fatal drug interactions. You're going to notice that a lot of medications have very similar names. And one of the most crucial responsibilities of us as nurses is to prevent fatal drug errors and drug errors in general. A nurse must follow the 5 rights of drug administration to treat patients properly. Okay, so we're going to stop there for now. In our next video, talk a little bit about antibiotics. And this is a really important drug class to know about. And so we're going to focus on that in the next video. But I hope this kind of gave you a little basis, a foundation for what you're about to get involved with. You're going to make it out the other side. every nurse does. Otherwise, they wouldn't be a nurse. So you've got this. Thank you guys.